Skin cancer is the most preventable form of cancer. The risk factors for this are excessive exposure to the sun, particularly as children, occupational exposure, like farmers, construction workers, tanning salons, ultraviolet radiation or sunlight between 10 a.m. and 3 p.m., having a fair complexion, occupational exposure to coal tar, pitch, and creosote. Again, we have our construction workers, arsenic compounds, or radium. Skin cancer is very rare in blacks due to the heavy skin pigmentation. It tends to protect them from the ultraviolet radiation. They can sunburn, but it's fairly rare that they do. There's a box on page 1058 that you need to look at for more information about that. There are different types of skin cancer. You've got your basal cell carcinoma. It's the most common type. This affects the epithelial layer. Basal cells rarely metastasize as they do not invade the blood and the lymph. It tends to occur more so in the face and the neck. You'll have depressed centers and rolled borders. It is slow growing. It can ulcerate and develop crusting. It is firm to the touch, but usually the melanin protects the skin against basal cell carcinoma. So the darker complected you are, the safer you tend to be. If anyone out there is old enough to remember President Reagan, he had 2 episodes of basal cell carcinoma that were removed while he was in office, and they were done as outpatients. Squamous cell carcinoma is, again, mainly of the epidermis. It is highly malignant if it's untreated. It's more so of the head and the neck. You get this firm nodule, and it can bleed very easily. It is considered a pre-malignant lesion. Occurs with sun-damaged skin, actinic dermatitis, leukoplakia, scars, or Bowen disease. Here's a picture of your basal cell carcinoma. This is a picture of basal cell carcinoma on the hand. This is squamous cell carcinoma of the ear and of the chin. Malignant melanoma is when the melanocytes degenerate and synthesize melanin. There's an additional risk of if they use steroids. Oftentimes you'll have a mole or a nevi as a precursor. So that's why it's really important to check those moles for changes in color or size, irregular notched margins, itching, bleeding or oozing, nodularity, scabs, or ulceration. The lesion thickness determines the staging, and the prognosis is based on when it is discovered. Kaposi's sarcoma is related to immunodeficiency, so patients who have had transplants, are on long-term steroids, or have HIV, AIDS, are at greater risk for Kaposi's sarcoma. It tends also to occur more so in middle-aged blacks in Africa and in persons of Mediterranean or Jewish descent. There are several forms. The classic will affect the legs first. There's also epidemic. Can occur after a transplant or with AIDS. It's a rapidly progressive form. The AIDS is associated with the herpes virus 8. The epidemic form involves the lymph nodes, particularly of the GI tract and the lungs, and you'll have symmetrical lesions over the upper body, the face, and the mouth. They'll form purple brown macules with plaques to the nodules. And if it is the AIDS form, it has a very poor prognosis. This is malignant melanoma. This is another malignant melanoma. Okay, we're going to talk about burns. When you talk about burns, you have to determine the area, body surface area that's been involved, and there are different ways in which to do it. The most common one that's done is the rule of nines, where it divides the whole body into different relationships to 9%. There is a table on page 1061 that discusses this also. This is a flow chart that's showing what happens when you have an acute burn. You're going to have direct tissue injury, and that direct tissue injury is going to increase capillary permeability. So that increase in capillary permeability is going to allow fluid to escape into the tissues, and you're going to have local and systemic edema. And that edema is going to put pressure on the tissues there and cause ischemia, and that's going to cause acidosis. It's going to depress cardiac function because not as much fluid is circulating. It's more in the tissues now, and it can cause multi-organ dysfunction. The the blood vessels, endothelial layer will be injured. That will cause leukocytes to come there, and that's going to increase tissue injury, again leading to the acidosis. You've got your systemic injury response. You'll have increased capillary permeability, again, hypovolemia, because the plasma is escaping into the tissues. And you're going to have hyperviscosity. In other words, the blood that's circulating is going to be thicker. And so you'll see lab values that are elevated, but they're falsely elevated because most of the fluid is out. So it's a dilutional issue, and it needs to be taken care of properly. So thermal injury to skin is burns, and it's classified by the degree of tissue destruction and the depth of the injury. First degree of superficial burn involves only the epidermis, and you have a lovely picture of a sunburn right there on your upper right. The skin is still able to function as a barrier. It's painful, causes redness, but there's no scars, and it heals after 4 to 5 days. Second degree burn, on the other hand, or a superficial partial thickness burn, will develop a blister. If the blister is removed, there'll be severe pain because the nerve endings are exposed. You should never, ever, ever poke a blister as long as the blister is intact. I don't care if you got it from a burn or if you got it from hoeing in the garden. You want to keep those blisters intact because they maintain the integrity of the skin. It still is a barrier at that time. That blister area usually lasts 3 to 4 weeks before that fluid is reabsorbed. But again, if this was a healthy person to start with, there will be no scar formation. But the severity of how they respond, it depends upon their age, their medical history, the extent and depth of the burn injury, and the body area involved. Causes of thermal burns could be from flames, hot liquids, or radiation, or non-thermal burns would be your chemical burns from acids or alkalis. It could be an electrical burn. Again, here's your first degree superficial burn, lower legs. This is a superficial partial thickness injury. Notice how much edema there is here. So you've got some blistering here. Your second degree or deep partial thickness burn is when you have a waxy white skin. The entire dermis is involved. This will take weeks to heal, and they can form scars or contractures and can decrease the functionability of that extremity. Third degree or full thickness burns involve all layers of the skin and can involve down to the muscle and the bone. And we have pictures of legs. The man is not standing, he is lying down, but to get it to fit on the screen, I stood him up kind of. But you have a leathery, dry appearance to the skin. It's painless. Third degree burns don't hurt because you destroyed the nerve endings. But the only time you have a total third degree burn is when you have somebody who's burned to a crisp. There's going to be areas that are second and first degree that are in there also. So this is painful. If more than 20% of the total body surface area is burned, that's considered a major burn. It will cause shifts of proteins and fluid into the tissues that will cause hypovolemia and shock. And that all starts because of an increase in capillary permeability and that fluid shifting into the interstitial spaces. Because that fluid is shifting into the interstitial spaces, it will increase blood viscosity or thickness, it will increase your hematocrit, and it will artificially alter your electrolytes. You'll have an increase in cortisol, glucagon, insulin, catecholamines, your basal metabolic rate will increase, your clotting factors. All these will cause further problems. This is a full thickness burn of a hand. This is showing a burn scar contracture. This is showing some hypertrophic scarring that occurs. Now the thermal injury could also be frostbite, which is, since I'm taping this over the Christmas break, it actually snowed for Christmas. It is a possibility. This is due to mechanical injury, that exposure to extreme cold that impairs your circulation, and it causes ice crystals to actually form in the blood vessels. So this will cause direct injury to the tissues. The skin will become white, waxy, numb, and pain-free. Now, mild frostbite, the skin is red and they complain of a lot of pain, but that will return to normal after rewarming, and you usually rewarm it with a little bit of either snow and or cold water, and then gradually rewarm. Moderate, you'll have cyanosis, redness, swelling, and a burning pain of the extremities, and that's going to take 24 to 48 hours for new skin to form. Now, severe actually causes gangrene, and you'll have loss of that affected body part, your toes, your fingers, your ears, your nose, your cheeks, the areas that are out and exposed to the air. And this is showing frostbite of the fingers and of the toes. The one on the right should get better. The one on the left, they may lose some digits. Hirsutism occurs in females, and this is the abnormal growth and distribution of hair in a male pattern. It's probably due to androgen sensitivity. It may be secondary to adrenal or ovarian disease. And this is a picture of hirsutism. And that finishes part 3 and finishes the lecture on integument.